Hi everyone, and welcome back to the Hair Loss Show, episode 67. In today's episode, we're going to talk about finasteride again and sort of what your expectations are should be if you're taking finasteride. So stick around, we'll go through that.
Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, and thanks again for watching. If you like the channel, please remember to like and subscribe to it. It helps get the content out there. And in today's episode, I wanted to unpack a little bit more about what the expectations of finasteride should be. So we've gone through a lot of episodes on finasteride, its role as a blocker therapy to try and lower the level of DHT at the level of the hair follicle to try and stop that miniaturization process from happening. But one of the things we've got to talk about is, well, what are the long-term, not only effects, but what to expect from it going forward. And the first thing to understand is that we don't have the cure for hair loss, right? So we know that finasteride does block that 5-alpha reductase enzyme, but it doesn't turn off the gene and certainly doesn't cure hair loss at all. And it's brought about by the statistics and the studies that have been done on finasteride, and if we look at its efficacy over time. So what does that mean? So we've looked at guys that are taking finasteride. At 1 year, what it's shown is that 89%, about 9 out of 10 guys, will show stability in their hair loss, meaning that they will show no progression of their hair loss. And that reduces over time. So at 2 years, that figure drops down to about 82%. And the 5-year mark, which is all that we've got data for, is 64%. So what that means is if you take your finasteride for 5 years, you've got about 2 out of 3 chance of stabilizing your hair loss. So does that mean that in 6% of people finasteride is useless? No. What it probably means is that, first of all, that we don't have the cure, but also what it means is that in those individuals, they've probably experienced less hair loss. They're still experiencing hair loss, but they're probably experiencing less hair loss than they would if they hadn't been taking finasteride. But if we look at those figures again, and look at the broader picture, well, what does it mean? Why is there a drop in efficacy of finasteride over 1 to 5 years? And we can probably extrapolate that and say at 10 years, it's probably going to be even less. Is it because finasteride just loses efficacy, we become resistant to it? It's probably not. And I think it highlights the fact that we don't have the cure for hair loss, and we probably don't fully understand what causes hair loss. So I think the efficacy of the drug is probably still the same. It's just that there is another aspect to hair loss that we haven't been able to fully quantify and qualify that is still left unchecked and at play. So if you look at, for example, if you look at histology studies of people that are suffering from androgenetic alopecia, one of the hallmarks is there's miniaturization of the bulb of the hair follicle, and we know that we've studied. We know what causes that, and that we think is DHT. So finasteride acts in that way. But there's also some inflammation that goes on. So if you look at the histology slides, there's an inflammatory process that's existing at that cellular level. Now that obviously finasteride is not dealing with, and we don't know what impact that inflammation is having. So there's probably an inflammatory component that's resulting in that sort of slow leak of hairs, even if someone is on finasteride. So finasteride is not the be-all and end-all, and certainly all the medical therapies that we have, be it minoxidil, PRP, Regeneron, low-level laser, whatever you're using, but we know that they can be used in combination. But there are still things that are unknown and are left unchecked that could still be at play. So finasteride is useful. and it can be effective in trying to slow down. In some people, it halts the progression of hair loss, even in the long term. But there are still people that are going to slowly leak hairs, even though they're on finasteride. So it's about finding out, where you are in that population, and what other therapies, if required, can be added into the mix to try and stabilize that hair loss going forward. All right, so I hope you found that useful. Thanks again for watching, and we'll see you again on the next episode. Take care.